are she, her, and hers. I am an intern at the Women's Center, and I will be moderating today's event. Today we have Dr. Laura Smolinski, who is a part of the UWO College of Nursing, and she is also a forensic nurse, and Leah Eckhart, who is the forensic nursing program coordinator at ThedaCare. They will be providing an overview of forensic nursing slash SANE services at ThedaCare, and then afterwards there will be an opportunity to ask questions.
Thank you, Michaela. Thanks so much for being here, everyone. I'm really, really honored to be here with you all and to share my love of forensic nursing with you. Laura, do you want to introduce yourself and say hello quick?
You're muted, Laura.
You know something? If I've had a quarter for every time I did that, I could pay somebody's tuition, I think. I've been a nurse for 30 years, most of them in the ThedaCare system. I've also worked at UW-Oshkosh since 2005, so I have a few years of experience. I've always said that being a nurse makes me a better teacher, and being a teacher makes me a better nurse. So I've always liked doing both. But I've worked as a SANE nurse kind of on and off since 1998. So I've been doing this for a while, but life happens and life gets weird trying to get your dissertation done. And I took this back, but I just recently started doing SANE Call again. And one of the things I love about SANE Call is you get to make a difference in somebody's life. They're having the worst day of their life, and nurses get to make it a little bit better. So happy to be here. And Leah, I'll send that back to you.
Sounds good. Again, I'm Leah Eckhart. I am the program coordinator for our forensic nursing program here at ThedaCare. I'm primarily located out of our Appleton hospital. Occasionally travel over to Neenah to do exams, but mostly all of our exams are done right here in Appleton, kind of in the back corner of our ER. So without further ado, let's get started here. So what is a SANE? SANE stands for a sexual assault nurse examiner. Sometimes you hear a SAFE, and that would stand for a sexual assault forensic examiner, or even an FNE, a forensic nurse examiner. So kind of depending on where you are in the country and what program you're a part of, there's different acronyms and titles. Here we refer to our program as SANE, sexual assault nurse examiner. So SANE falls under a really broad umbrella of forensic nursing. Forensic nursing is a fairly new field of nursing compared to all the other avenues of nursing that nurses can get into. This is a fairly new and upcoming specialty, which is exciting. There's a few other areas that fall under forensic nursing. Those areas could include death investigators as well as medical examiners. Forensic nursing really is just this very specialized area of nursing that does intersect with the legal system, which is very interesting. Our sexual assault nurse examiners here at ThedaCare are all registered nurses. Our nurses, we have 2 years of nursing experience, bedside experience, before undergoing the additional training that's required to be a SANE nurse. Here in Wisconsin, the Department of Justice offers our training for our nurses. So our nurses go through a 40-hour training offered all through the Department of Justice. There's a SANE program coordinator that oversees all the SANE programs in the whole state, and she runs this training program. So our nurses go through that, and then they do have a clinical preparation as well, where they have some hands-on experience with trained nurses, seeing exams and doing pieces of the exam until they really feel comfortable. As you can imagine, no 2 exams are the same, and it's really difficult to prepare our nurses for what they may see and hear and need to do. So we really want to give them as much experience prior to being on their own as possible. Once our nurses feel real comfortable with that adult adolescent population, we then send them back to the Department of Justice to receive a pediatric training. That is an additional 40-hour training where our nurses are specially trained in doing SANE exams specifically on pediatrics. So similar to other fields within nursing, there is a SANE certification that our nurses can sit for. So This is something that is kind of above and beyond. It's not required. You can still practice as a SANE nurse without this certification. To be able to sit for the boards, you need to be able to prove 300 hours of SANE-related nursing care, and obviously have to have gone through all the training. And then SANEs are able to sit for that board certification and then become SANE certified. One of my favorite parts of my job is that we work really closely with many different pieces of our community. We work very closely with law enforcement, the district attorney's office, child advocacy centers, as well as our sexual assault crisis advocates within our community. I will say it's really important. These exams are really patient-centered, and it's really important to have this team of people who believe our patients and who are willing to just be an army behind them, and whatever the support looks like for that person, just to be able to offer that support. It looks very different for each patient. I have a little news clip I want to share with you. It's a 4-minute news clip that was put out by NBC last year. I do want to just preface with a couple of things before I show you the video. The first thing I want to say is that I want to give a warning that this could be a trigger for some. I know that we all come from different backgrounds and different experiences, so I do want to put that out there. Secondly, the beginning of the video, the news broadcaster says something, and right away it caught my attention because it's inaccurate. So I just want to let you guys know that before I start it. I wrote down exactly. He says he's addressing a problem that's a disturbing reality for many women who survive rape. And I want to put it out there that this is not a problem that is exclusive to women. This is a problem that is exclusive to our human population, and it doesn't matter your gender, it doesn't matter your age. So we see people from all walks of life, and so I just wanted to put that out there. I'm going to show the video.
Leah, I don't think the audio is working on this. Is anybody else not hearing it?
I wonder how I make it work. Try one more time. Anything?
Maybe just turn the closed captions on and we can read the text.
Okay, let me back it up. Apologize that the audio was not working on that. Can you all hear me now?
Yes, we can hear you.
Thank you. So you may have some questions after hearing that. I know it might feel a little bit shocking, but I guess it's the reality. So I want to go in a little bit more on specifically what does a SANE nurse do and what are we trained to do? Why does it require all this extra training? This basically is a list of the things a SANE nurse is trained to do in an exam. The first thing being to collect evidence. Nurses are trained to maintain the chain of custody with that evidence, and we see that through to law enforcement's hands. We are trained in identifying patterned injuries. Patterned injury is defined as an injury that is caused by an object that can be reproduced. So an example of a patterned injury would be perhaps if someone is hit with a belt, or and then if they have that, being able to say that definitely this injury was caused by this object. We also receive a lot of documentation training on injury. I will say, when I went through my training to become a SANE nurse, I learned so much more than I learned in nursing school, just very specific to injuries and, what maybe I would have called a bruise before I took this training, I may not call a bruise in my exams now. So very, very in-depth, detailed training on injury documentation. We also offer forensic photography. This is exactly what it sounds like. We take photos of injuries, and these injuries are used for case review. It can be for case review, and oftentimes can be used in the legal process as evidence. SANE nurses are sometimes called to court to testify. There's two different reasons that we may be called. The first is that I have listed as an expert witness. This would be being subpoenaed into court, not for a case that maybe I did or an exam I did. It may be one a colleague did, or even in a different community. Being able to just share our expertise regarding SANE exams. I know I have a fellow SANE nurse who has been called to be an expert witness on delayed childhood reporting. So why do children often not report sexual assault or sexual abuse immediately after? The second thing we could be subpoenaed for is a fact witness, and this would be being subpoenaed for a case that we did and we performed, and that's just testifying to your documentation and to what you saw and what you heard. Lastly, we do offer suspect forensic exams. Really, this maintains our neutrality as a program in the court of law's eyes. So we never would have like a victim and a suspect here at the same time. Sometimes a victim may be brought to one health facility where the suspect is brought to a different health facility to have their SANE exam and have evidence collected off of their body, looking for the victim's DNA on their body. That would just help in a legal investigation. I think I covered all of this, just our training requirements. Like I said, we have to be a registered nurse, 2 years of nursing experience, and then both of those 40-hour trainings through the Department of Justice. So what kind of patients do we see? SANE nurses really are trained to deliver just this really compassionate, patient-centered, expert forensic care to crime victims within our community. We can see victims of sexual assault or sexual abuse. We do see child abuse, strangulation, elder abuse, and intimate partner violence. And I will tell you, it's very rare that you see only, in one case, that you would have only one bit or one piece of this list. Oftentimes, the patients that we see, the crimes are very interconnected. So it's not unusual to have someone who's coming in to be assessed after a sexual assault who also was strangled. So it's a very interconnected crime often. So what is a sexual assault? Really, a sexual assault can take many different forms, but the one thing that remains the same is that it's never the victim's fault. It takes a lot of courage for someone to come forward and get care, and just all the support that we can provide to them, the better outcome that they will have. Just a broad definition, sexual assault is an act in which a person intentionally sexually touches another person without that person's consent, or coerces or physically forces a person to engage in a sexual act against their will. And as you all know, perpetrators of sexual assaults can be neighbors, teachers, coaches, intimate partners, peers, friends, family, really, it can be anyone. A few statistics I just want to share with you all. These come from the RAINN website. It stands for Rape, Abuse, and Incest National Network. Every 73 seconds, another American is sexually assaulted. 1 out of every 6 American women have been the victim of a rape or an attempted rape at some point in their lives. 1 in 33 American men have been the victim of a rape or an attempted rape at some point in their lives. Rape is the most underreported crime. Only 230 out of every 1,000 sexual assaults are reported to police. And that means that 3 out of 4 go unreported. And over 30% of victims will never disclose their abuse to anyone. I found this chart to be really interesting and I wanted to share it with you all. And this is kind of goes back to that previous slide a little bit. So out of every 1,000 rapes, 995 perpetrators will walk free. And this kind of breaks that down. So out of 1,000 rapes, 230 are reported to police. 46 of those will lead to an arrest. 9 cases will get referred to a prosecutor. 5 cases will lead to a felony conviction. And 4.6 rapists will be incarcerated. As I mentioned earlier, the SANE exam is really a patient-controlled exam. The patient, one of our primary goals is to just restore and empower our patients to take back some of the power that they've been robbed of. So after someone does experience a sexual assault, it's very common for our patients to feel as though all of their power and control has been robbed of them. And sometimes it's hard to even know where to start for them to just regain some of that confidence. So really it's our job to listen, to give them all of our time and our ears and our compassion. And secondly, to really inform them about what all of their care and treatment options are. I always like to tell my patients, educate them on each part of the exam, but really enforce that they are the driver of the exam. And really, they are the only one who can determine what's right for them and what kind of care or treatment they want. And that will be respected. The SANE nurse respects their decision in all of that. So we're offering a very compassionate, patient-centered exam in a trauma-informed manner. And ultimately, trauma-informed care that's sensitive and compassionate allows our patients to begin to move from victim to survivor. So what happens during a SANE exam? As I said, we really educate our patients on the options, on what kind of care and treatment we're able to provide them, and these are those options. The first would be a physical examination. We do a head-to-toe exam on our patients, and we assess and treat all injuries. We do evidence collection for adults. There's a kind of a rough, we say 5 days after assault, there are considerations to take into consideration, or there are things to take into consideration when determining if we will collect evidence or not. But as a general rule of thumb, up to about 5 days, we are able to collect evidence. We are able to test for drug-facilitated sexual assaults. By law, we're required to offer emergency contraception to our patients. We are able to assess for the risk of sexually transmitted infections and also provide some prophylactic antibiotics that would help prevent the spread of sexually transmitted infections if they've been exposed to those. We do offer forensic photography of their injuries. Again, we work very closely with advocacy. We have someone from either the Sexual Assault Crisis Center or Reach Counseling, an advocate, a sexual assault crisis advocate, come to each of our exams. And if the patient is willing to allow them to be a part of even portions of the exam or the whole exam, they really are there to support our patients emotionally. They help them they see them through the entire journey, because this is a journey, it's not a sprint for our patients. Like I said earlier, we work very closely with law enforcement, the state crime lab, district attorneys, the Child Advocacy Center. And then we do offer discharge safety planning for our patients. So SANEs are mandatory reporters, and that really means that anyone under the age of 18, we are mandated by law to report any abuse or suspected abuse. If the patient is 18 or older, this decision is given back to our patients. And again, this just really allows them to have some of that power and control over their body back. The first option that our patients are given is to make no report to law enforcement. In this case, we would not collect evidence. We would, do a physical exam, assess and treat any injuries, provide medications, provide all that support and resources. The second option would be to report to law enforcement and begin a legal investigation. In these cases, we call law enforcement and make that first contact, and often law enforcement will come right to our exam room. This is a really patient-centered approach. It minimizes their need to leave us after a 4-hour exam, go to law enforcement, and then sit through an interview. So really, this is just a great example of the community coming together to support our patients. The third option is what we call delayed or undecided reporting. In this case, there's no initial report made to law enforcement. However, we still collect the evidence off of the patient's body, and then we as SANE nurses can submit that evidence to the crime lab in Madison. The crime lab stores it for up to 10 years, and this really gives patients time to process what happened to them and gives them time to make those really, really big, heavy decisions of should I notify law enforcement or not. This is a really great option for people who just come to us very uncertain of what to do. So what resources are available to crime victims? Like I mentioned before, our sexual assault crisis advocates, I have learned to absolutely love them and appreciate their presence in my exam room. I always tell my patients that these advocates really are like a faithful friend who walks this road alongside of them. They accompany them to any police interviews. They accompany them to court. They connect them to resources as far as counseling. It's just a really vital piece for our patients that I do really appreciate. Secondly, Wisconsin has something called the SAFE Fund. The SAFE Fund basically is a reimbursement to the hospital for the SANE exam. So this is really wonderful. When a patient comes to us, they're not registered as an ER patient. It's registered under a very private account that cannot be accessed by any other providers within the system. And the hospital sends a bill to the SAFE Fund, and the SAFE Fund reimburses the hospital for the charges. So our patients do not see a bill for their time with us, which is amazing. And also insurance is not billed then either. Thirdly, there is something called the Crime Victims Compensation Fund. This is a fund that often our advocates work with our patients on after they leave our exam room. This is a great fund that reimburses victims of crime up to $40,000. They can reimburse for things like lost wages, mental health services, any pharmacy or medical costs outside of the SANE exam, lost clothing or bedding, and property replacement. I want to pause and talk about our patients a little bit. I want to talk about the impact of sexual assault on somebody. As you can all imagine, sexual assault can have a long-term impact. There can be psychological effects, emotional effects, and physical effects. So what do the psychological and emotional impacts on a survivor look like? I have this quote on here that I really love. Trauma disrupts reflective functioning. Indeed, it nearly wipes out the ability to think. And I will tell you that I see this so often in my exam room. We have a very specific list of questioning that we go through with the patient. Questioning seems a little, not the right word, but oftentimes when you ask patients these questions, trauma does really interesting things to our brain and can kind of block out certain memories. And it's not unusual to be sitting with a patient and for them to kind of start to remember things that maybe they hadn't remembered before. And I always like to reassure my patients that that's really normal. Your brain is just doing its job. But outside of that, long-term effects can look like depression, flashbacks to the event, post-traumatic stress disorder, suicide ideation, substance abuse, eating disorders or dissociative disorders, which is really this disruption or breakdown of the memory in a person's awareness, identity, or perception. So this right here is exactly why advocacy is so important, to really walk this road with our patients and connect them to any resources they may need. Physical impacts on a survivor sometimes can look like a pregnancy, sexually transmitted infections, sleep disorders, physical injuries related to the assault, increased risk for high blood pressure. So as you can see, trauma does have a real and measurable impact on survivors. That all feels really heavy, but I want to say that there is hope and there's healing. And I really believe that the first step towards that healing is offering our patients a compassionate, personable, and a very patient-centered, patient-controlled exam. It really helps to restore power and control that they have been robbed of. And over time, with professional help, survivors can process the abuse and begin to move forward in the healing process. The Wisconsin state law requires that every victim be offered an advocate. And I've talked at length about advocates, and I don't think I need to read through all that, sorry. But like I said, we work very closely with the Sexual Assault Crisis Center and Reach Counseling, and I believe UWO has their own advocacy center as well. That is all I have for you, but I'm excited for your questions. So if you have any questions.
Thank you so much, Leah, for presenting and just being here, sharing information about SANE nursing. It's definitely an important job that needs to be done. So if anyone has any questions, they can either raise their hands or type it in the chat. Gabby?
Thanks, Michaela. As Leah kind of ended the presentation, I will reaffirm that UW Oshkosh does have campus advocates who are able to take students to SANE exams if they would like. I happen to be one of those advocates. I know Leah mentioned that like the SANE area is part of the emergency room at ThedaCare, but I'm wondering if you can just elaborate on like how a student would kind of get there for an exam. Do they have to call someone to make an appointment? Do they just show up? Can you kind of walk through that process?
Absolutely. So there's a number of ways our patients make it to us. Sometimes they just walk into the ER and say that they need a SANE exam. And then our nurses are all on call at home. Unless I happen to be here in my office, then I can walk down the hallway. But otherwise, our nurses then are called at home to come in to respond for the SANE exam. Sometimes we have law enforcement reach out to us that they are interviewing someone or have a patient with them that needs a SANE exam. Yeah, so even just calling the emergency room as well and just saying that you are in need of a SANE exam, they would call in the nurse and hopefully, you would get here maybe at the same time.
Thank you.
Sometimes we also,
go ahead.
I apologize. Sometimes we also get calls from other facilities. St. Elizabeth's does not have a SANE program anymore. So every once in a while we get a call from SANE saying, hey, there's someone here for a SANE exam. We can't do it here. Can we, transfer them to ThedaCare and do it there? So then we meet, we meet students, or I'm sorry, we meet patients where they are and, transfer people where we can help them.
I did have one other question while other people think of their questions. And it was kind of for Laura, because you have a role both at ThedaCare and at the university. Can you elaborate on the confidentiality piece of being a nurse, but how and how that might be separate from your role at the university as a responsible employee who would typically have to respond or report sexual violence.
It is a little different, and I actually had to ask a couple questions because, like, what do you mean I have to report? Like, it's their choice. And as a staff nurse at ThedaCare, it's confidential. But if someone comes to me in my office as a professor, then that would be a different role, and then I would report that to the dean of students office. So be aware that if you come and see me at ThedaCare, that is going to be different than if you come and see me in my office at UW Oshkosh. Does that make sense? Because in Wisconsin, the law is different. In Wisconsin, as a SANE nurse, if someone comes to me under the age of 18, I'm considered a mandated reporter, which means even if you say, please don't tell law enforcement, if you're 13 years old and I find out that you were sexually assaulted, it is my legal obligation to report that out. But it's a little different as a professor, as a mandated reporter, as a professor. I know that's confusing. Does that make it more confusing or less confusing?
I think it makes sense to me.
Okay.
I think maybe I'll reframe in yes or a no way, but if you saw a student at ThedaCare, that would not be something that would get reported to the university.
Correct.
Okay.
And I'll tell you, if you're a nursing student and I know who you are and you see me at ThedaCare, I don't tell anybody. It's not like I'm going to, like, hey, you're never going to guess who I saw at ThedaCare. As nurses, we take that very seriously. HIPAA is one of the first things we teach in nursing school, as far as we're a trusted profession and we take that very seriously. We are going to keep your confidential information confidential. So if you see me in the ER, it's not something that I'm going to report in class saying, I have this story for you. That doesn't happen. There are stories I tell in the ER, or in the ER, excuse me. There are stories I tell in class, but they are stories that I tell without names, without identifying information. We want you to learn from, things that I've done and mistakes I've made, but I would never give away any personal info or names associated with those stories.
Thank you for clarifying that. I think that's just helpful for students in campus to know, especially when folks on campus have kind of those dual roles in different spots. So thank you.
I have a question. So are SANE nurses just SANE nurses, or do they usually have a job on like a floor as well?
That's a great question. And the answer is both. We have SANE nurses in our program who work in the emergency department. We have SANE nurses who work in OB. We have nurses who work in the clinic. We have nurses who are like me, who have a second job, and that's all they do is take call. How we used to do SANE is I'd work a shift. I worked 7. I know this sounds awful, but I worked Friday, Saturday, and Sunday, 7P to 7A. That was my shift at ThedaCare. And if there was someone who came in who were sexually assaulted, I would kind of stop what I'm doing in the ER, and then this would be my patient. This would be my job. The problem with that is sometimes in the ER you get busy, right? We had 2 traumas coming in, and we got a car crash, and the helicopter's coming in with a stroke patient, and we don't want this patient who's having the worst day of their life to have to wait. So now with this new model, I am, this patient is my only priority. I come in and this is my job. So it's a little different depending on where you work. But you don't have to be, the reason we always used to have ER nurses be SANE nurses is because of the critical thinking piece. And it's very autonomous as far as you have a patient and you they don't see the doctor, they see you. And rape isn't about sex, it's about violence. And we have to, maybe they were strangled, or maybe there was a concurrent head injury, or maybe there's something else going on, and we can we can find that out. But you don't have to be an ER nurse to be a SANE nurse. We find it's a very diverse field and lots of places you can go and then, still kind of do SANE kind of on the side, depending on where you end up in nursing.
Okay, thank you. Alicia has a question. If someone was considering becoming a forensic nurse, what would you tell them, or what should they know before pursuing this specialty?
That's another good question. I generally recommend you wait a couple years because there's so much in nursing school, and you think have all of this knowledge, but what you are going to find is you're going to go into the workplace and you realize, oh my gosh, I don't know anything. And it's going to be overwhelming. First, you got to take the NCLEX, and then you're going to have to kind of learn whatever specialty you start in. If you start in the ICU, you're going to want to take the CCRN exam, and you're going to want to learn about BiPAP, and you're going to want to learn about ventilators and learn about how to take care of strokes and all this extra stuff. And SANE is one of those extra things. So have a couple years of ER experience under your belt before you start. That'd be my number one thing. Two is have a conversation with a SANE nurse and kind of to make sure you know what you're getting into before you start. That it does involve call. That sometimes you do get called in for to testify in court and things like that, and then make an informed decision as, is this something I want to commit to? Because what we don't want is you to say, hey, I want to be a SANE nurse, and then we send you through this 40 hours of training, and you do it for 3 months, and you realize like, ooh, I don't think I have to look at people's vaginas. Are you kidding? And then and then we'd like to avoid that. So that would be Leah, anything you want to add as far as that goes? Because you get that.
I would just add one piece is that our role is super autonomous. Like any other role in nursing, you have colleagues that you can just like run over and be like, hey, I have a question. I don't know what to do about this, or what would you do? We don't have that. So when I'm called in for a SANE exam, chances are there's no one in the ER that is a SANE nurse at that time. So so that's another reason we really like people to wait 2 years, is just so they can kind of gain their confidence as a nurse and have experience using that critical thinking. And because, sometimes it can be a little scary, like, okay, like this is totally new. I've never seen this before. What am I going to do? So that's another reason we ask people to wait a couple of years and get some good experience under their belt.
Yeah, we do sometimes ask each other. And Leah, I send you texts or emails after almost every exam I do saying, hey, take a look at this picture, or this was kind of weird. What do you think about this? And there's always an ER doc there. So if something really weird happens, hey, this person's asking for detox, and, can you help me out? And so that's kind of a safety net.
Yes.
The ER is your safety net. If something really weird happens and, you're coding your patient, or they need they're having shortness of breath and they're having a COPD exacerbation, they're, something with alcohol intoxication or something related to something above what you can do in your protocol, there's an ER doc to back you up, which is nice. Katie, also, you asked a great question about how do we keep our own mental health in check after seeing so traumatizing situations as a SANE nurse? And that is an issue. There's a couple different terms for that, secondary trauma. And that is something that we have to be aware of. I remember one case, one of the first ones I had is a dad took a hot curling iron, and this might make you just kind of nauseated just thinking about it, but a hot curling iron up into their daughter's vagina because they were mad at their mother for having an affair, and thinking about that, that burn and how awful that is, and that you see some things you can't unsee. And I do tell potential new SANE nurses that every case takes a little bit out of your soul, that how can someone do something so awful to another human? And it helps to be able to have an outlet, and it helps to continuing education, and it helps to have some support to be able to debrief some of these things and reflect on some of these things. It does help, and this sounds a little weird, but it helps when we get somebody, when we take a rapist and we put them in prison. It makes you feel like a little bit good about yourself, which maybe sounds bad, but it does. Every time we get a rapist in prison, I feel like, yes, we did something good today. But that is a real phenomenon. Leah, do you want to add to that as far as how you keep your mental health in check?
Yeah, I mean, very similar to you. And I think just trying to maintain normal life, I think that we see like the worst of the world. And I have found that being able to go home to my kids and kind of put on my mom hat or my wife hat and really be purposeful about doing the things I love, that just kind of, refreshes me to be the best for the next patient.
Yeah, and it makes you a more grateful human. I had a case of a human trafficking victim who came from out west. She came from, I think it was Wyoming, and she was trafficked in Wyoming, and the trafficker drove her from one state to another, and she was raped in this state and raped in this state and then raped in this state and came to Wisconsin. And sometimes we are the first people who believe them. Sometimes we are the first people who they can vent to, and that can be quite powerful in a victim's in a survivor's healing. So we take that seriously, that we can have some power in helping people turn corners and to get on a better road. We have conversations about drug addiction and alcohol use, and there are numerous patients who aren't in a good place, and helping realize that there are people who care can be life-changing for a lot of survivors. Sorry if I'm being a Debbie Downer.
I have another question. Do either of you know if other states have the SAFE funds like Wisconsin?
I believe so. I think most of the states do. I will say that if it gets a little interesting if we have a patient come to us who was assaulted outside of the state, because it's based on where the assault occurred. So if someone was assaulted in Minnesota, we are not able to file for the SAFE fund here in Wisconsin, but we could work with Minnesota to try to see, if there's something that could be done there so the patient doesn't receive those bills. We still want to see those patients. But we do see that occasionally with maybe someone went on spring break and then when they get home, they feel brave enough to come for an exam.
The case I was telling you about before, we actually had to get the FBI involved, and just because it's a little bit of a jurisdictional nightmare, so the FBI got involved and helped coordinate that case. And they have other resources that we can lean on as
well. Alicia has a question. Aurora provides a travel voucher for returning home from the ER. Does ThedaCare also provide a voucher?
We've had to get creative with this. We do have like gas cards to give our patients if they're in need of that. We have a lot of ways we can help. To be honest, I don't prefer putting someone in a cab and having them go back to campus that way. I think especially when their safety is our first consideration. That's not my favorite way to do things. We have worked with advocacy or law enforcement to help transport our patients back to, but we always make it work for sure.
Our advocates are wonderful. And our police officers, I know that there's been a lot of bad press lately about police officers, but in the Valley, we have wonderfully kind police officers who go out of their way to assist victims. And that often includes, do you need a ride? And I've seen them do that numerous times. And our advocates as well. Is there someone we can call? Yeah, we do have a contract with a couple of the taxi companies, and that's kind of a last resort. So we will work with people however we need to.
Does anyone have any other questions?
sometimes these conversations start and then you start thinking about things. You have my email, so if something comes up, or else you can always come find me in the CLO nursing offices. So don't be afraid. I'm more than happy to continue these conversations. Oh,
Same.
moment of
I welcome
joy.
emails.
Leah, you want to go first with this while I think of something?
With what?
Do you have a favorite memory or moment of joy from your time as a forensic nurse?
Ooh, I will be very honest. I feel like at the end of every exam, I feel like I have maybe given my patient a piece of hope. And I walk away from my exams feeling good about that. And just, giving people like all the love, the support, the kindness, the compassion, the empathy, and also giving them resources. So I will say at the end of each exam, I do feel a tinge of hope. And I feel really proud of my patients because it's a really hard thing to do, to come to an ER and say that you've been assaulted. So I have a lot of respect for my patients as well.
Two things that have come up for me. One was Country USA, and I know Country USA just went bankrupt, but I don't know if any of you have been to Country USA. I never liked doing call on Country USA weekends because it was always busy. Imagine having, all this alcohol and camping, and we had lots of assaults. And there was one Country USA weekend where I had 3 calls right in a row. I did 3, and they were all alcohol facilitated assaults, and it was all kind of the same type of assault where a perpetrator went in, found somebody who was drunk to the point of being incapacitated and assaulted them, three times in a row, and making a difference. People feel helpless and really feeling like, hey, I made a difference. The other story, this is going to be a little bit of a weird story, but it changed my life. We had a really slow day in an ER, and it was sometimes when we're not that busy, the police department comes and hangs out. And one day we had one patient in the ER, one patient in the whole ER, and it was a SANE patient. And that veteran of the Neenah Police Department, who I respected, made a comment of, I've been a police officer for 15 years and I've never seen a real assault. And it made me stop in my tracks and realize how much work we have to do as far as these assaults are real. Just because you're assaultant does not mean this assault wasn't real. And it made me realize how much education we have to do, not only as nurses, but as humans, to help people realize that assault does not mean just the stranger who, was running and attacked somebody in a park. Assaults happen because of violence in interpersonal relationships, and it can be acquaintance rape, and it can be date rape, it can even be husband and wife rape, and we have a lot of education to do. I know, Alicia, that wasn't your exact question, but that was kind of the memory that came up that has stayed with me for over 20 years. Ask one question, you get a different answer, right?
All right. Well, if nobody else has any questions, I would just like to thank you both for being here and just sharing what SANE nursing is and giving us background. Thank you.
Thanks for having me.
Yeah, and thank you guys all for coming. I'm looking at the list of participants, and some of you I don't know, so I don't know what walks of life you're from, or if you're pre-nursing students, or where you are at UW Oshkosh, but I wish you well. And it's not just nursing that can make a difference for people who've been sexually assaulted. To use the axiom, it takes a village, as far as support and encouragement. this, oh, sorry. This happens, like Leah said, from people from all walks of life. And so you probably will encounter folks who have been sexually assaulted in your, in your dealings wherever you end up in life. So.
And then Alicia also put a link for an evaluation to complete, if you could please. Otherwise, I hope you guys enjoy your day.
Thank you.
Mhm.